Hello.
Hello. Hi, Dr. Washington. Can you hear me?
Yeah.
Okay, welcome and welcome back, IMGs, to this webinar where we're going to hear about best practices for those IMGs who have the dream of becoming U.S. healthcare physicians. We're going to hear from a panel of recent IMGs who have successfully matched here in the U.S. They've agreed to graciously give back of their time. You're going to hear from them with regard to their story, their journey, the challenges that they've encountered, and you'll hear what they've come to believe are best practices for other IMGs to be able to realize their dream of becoming U.S. healthcare physicians. Afterwards, we'll have a Q&A, a question and answer period, in which you'll be able to enter your questions into our Q&A area, and we'll try to answer as many of those questions as we can in the time that we've allotted. I am your host, Dr. Roger Washington, and I'm a board-certified family physician, and I'm a graduate of the Stanford Medical School and the family practice residency there. For 30 years, I have practiced solo practice in the Silicon Valley of California, where I've been able to follow my passion for teaching and for learning. I've been recognized as a fellow of the American Academy of Family Physicians for the teaching that I do. I've taught physician's assistants, medical residents, medical assistants, and IMGs. For the past 15 years or so, I've hosted IMGs in my office, giving them an intensive, hands-on experience where they get to interact with American patients, learn U.S. healthcare culture, and I coach them with regard to their communication skills and being able to interact with Americans. You see, my idea has been that anyone who passes the USMLE STEP exams is capable of becoming a physician. However, in the States, the ability to communicate with patients is what sets apart those people who ultimately become successful. In addition, I've also written a book that compiles my clinical research and observations that suggests that it's the lack of sufficient sleep that causes the root cause of most of what we consider to be disease. Well, in a few moments, we're going to hear from our panelists. They'll introduce themselves, they'll tell you about their journeys, give you their ideas of best tips, and then we'll follow with the question and answer period. Before we do that, however, I'd like to conduct a brief poll. We're going to see who's joined us today. Let's start our poll, and please, you see that we're asking, what is your country of origin, or where was it that you trained? We have India, we have Asia and Pacific Rim, there's North America, the Caribbean and Central and South America, Europe, and the Middle East and Africa. Please enter your how you identify. Are we able to do that? Yeah, so I see that it's people are entering. It'll just take a few moments, and then we'll publish the poll and see where everyone has joined us. And so you can see our results here. Many people have identified from coming from Asia and the Pacific Rim, and 7% from India. That surprises me. And we have even a few from Europe and South America. Let's. I have another poll. Please join us and tell us. That wasn't right. The second poll has to do with the length of your gap year. We're asking, how long has it been since your training to now that you're trying to match here in the U.S.? Was it 1 to 2 years, 2 to 4 perhaps? Has it been 9 years or more? Many people have asked us in the past whether having a gap year is a challenge to becoming matched. Well, my opinion is that you should always consider every challenge as an opportunity. For example, if you were out for 5 years, that was an opportunity for you perhaps to do research or publish, or perhaps to grow as an individual, to read, to learn, to become more familiar with U.S. healthcare. And the idea being that never give in to the idea that something necessarily has to be a barrier or a challenge to your being ultimately successful. All right, so it seems that most are about 2 to 4 years. Okay. The last poll that I was planning to give is one that it's a question that I ask every extern that comes on site with me to learn. And what I ask, it has to do with communication. You see, communication is key to becoming a successful physician. Communication requires credibility. And so what I ask is, in the aspects of communication, the verbal communication, and again, the nonverbal communication, which do you think is the most important of the two? Or perhaps are they equally important, maybe 50-50? So it appears that, let's see what we have as answers. It says that most people think that both are equally important. And that was rather a trick question. In fact, what I do when I meet the externs is I say, let's look at the following example. If I were to say to my daughter, well, actually, and she's my favorite, by the way, I know that because she's told me so. But if I were to say to Maya, yeah, I love you. Well, the idea is that my nonverbal communication would give her a doubt. In other words, what you say to a patient or what you say to anyone has to be congruent with your nonverbal communication. Because if the nonverbal communication is giving a different message, then the person is going to go with what they see you doing and the way you're answering the question. So in order to be a successful physician, your communication skills are key. If your patient doesn't trust you, they don't believe you, they're not going to take your medication. You could be the best physician with the most up-to-date information, but if they don't take your medication or your advice, then obviously you'll fail. Well, thanks for letting me do that little poll with you. That's the kind of thing that I try to teach in our on-site, and we also do a telehealth externship, which we're going to start on August 1st, and you'll receive an offer to join us with that. Now, having said all that, I'm going to ask that we meet our panelists. First, I'm going to ask Dr. Michael Yu to introduce himself and tell you a bit about his journey. Please join us, Michael.
Hi, everyone. Can you guys hear me? Type in the chat if you can.
Yeah, I can hear you.
Okay, perfect. So just to tell you a little bit about myself, I was born and raised in Canada. I went to school in Ireland for 6 years. I did the undergraduate program there. And then I took a gap year before I applied for residency. And during that gap year, I met Dr. Roger Washington, who is fantastic, by the way. I have 3 main tips that I kind of want to share with you guys about what my personal process was. And just to give you a little bit of a background, my school didn't prepare me well for the steps at all. I think I studied for like a month and a half only. So I actually ended up having slightly lower than average scores for IMG standards, not American. But I turned that low score around, and I actually ended up matching to, well, I had like 11 family medicine interviews, which is a lot even for American standards. So the 3 main tips I want to share with you guys that I personally did was, by the time I decided to do family medicine, I was very, very focused in which electives I chose. So before I actually did three surgery electives. And then I decided to switch to family medicine. And at that point in time, I applied for 4 family medicine electives. And when I applied and I were interviewed, I told them, look, I want to do family medicine. This is all I want to do. All my electives are there. And that basically shows immense interest. And because of that, I think they really, really appreciated that. Family medicine doesn't like to be backup. They like to seek individuals who have really high interest in that field of specialty, who really understand that specialty. That being said, I also applied to almost every single family medicine program in the United States. And my reasoning process was like, I didn't want to take a gap year if possible. In my opinion, I've definitely seen people match, 5 years out of residency, 7 years out of residency for sure. But because I was new to this whole IMG world, I didn't know this fact before I applied. So I actually ended up applying to all family medicine programs. I think it was around $7,000 in total. And my reasoning process was like, if I took a year off, like I'm at risk of losing a year of potential salary. If I fail the first year, I have to reapply the second year to the exact same programs plus more. So I thought I would be better off just balling on the first year. And it looks like it paid off. I got 11 family medicine interviews. And the third and most important thing that I want to tell you guys is, even after applying to all the family medicine programming in the United States, I actually ended up cold calling all of them. I called every single program individually. I made an Excel sheet. I said, I talked to the program coordinator. I made a list of which ones accept visas and which ones don't accept visas, which, the USMLE cutoff was and all that. And during the conversation, I basically said, like, where I'm from, why I'm interested in the program, if it's like rural, if it's like urban, the fact that I like to have a very heavy OB focus or very heavy inpatient focus. These little details, I researched all of that before I cold called them. And basically after the cold call process, I went from 2 interviews that I got organically to a total of 11 interviews. And finally, I basically ended up matching at Mount Sinai Hospital in Chicago, which, by the way, because I was involved in the admissions committee, they said they have around 5,000 applicants a year, and they only accept 6 applicants. So definitely cold calling and applying to as many programs as you can, in my opinion, does make a huge, huge difference. Okay, so I think that's the 3 main points I want to share with you. So I'm gonna pass the mic on to the next panelist there.
Okay, well, thank you, Dr. Michael. So that what I heard you say is that it was important for you to be committed to family medicine and also to use your communication skills and try to make a connection and get an interview by contacting people there with information that was germane. Well, now we'd like to hear from Dr. Niru. Would you join us and tell us a bit about yourself and talk to the IMGs?
Absolutely. Thank you, Dr. Washington. So my name is Niru. I go by Niru. I am from India. I went to Goa Medical College there, and after graduation, I practiced in my hometown for a couple of years. I then proceeded to do my MPH at Yale University, and then thereafter I moved to UCSF to do research. And during that process, I took my steps and I applied for the residency match. And it was during this time that I met Dr. Washington, and I did a month of externship at his clinic. So when I applied for the residency match, I was about 7 years out of graduation, which many programs viewed as an unfavorable prospect. But with my research experience, clinical experience, and just having had a lot of clinical experience over the years, I was able to turn that around and was successfully able to match at Mount Sinai, St. Luke's and West Hospital in New York City. I just recently graduated from my residency, and I am pursuing a cardiac imaging fellowship right now, and I'm actually applying for cardiology fellowship this year. In terms of tips about successfully matching into residency in the US, I would say first and foremost, start early. If you think you want to practice in the US and you want to do your residency here, start early when you're in med school. Try to do your externships in your intern year so that you get more hands-on experience. The second thing is networking is really everything. So when you start early and you start to do your externships in the US, try to form meaningful connections and try to find people that will vouch for you so that when you apply, these people can actually call some of the program directors at places that you like and vouch for you and say, hey, I worked with this person. They're really fantastic. I think they'll make a great resident. That's the kind of thing that people want to hear. So really networking is very, very important. And then the third thing is, if you have gap year, if you have low scores, anything that programs may view as unfavorable in an application, try to stand out in your application in terms of other things that you can show them, like great communication skills, research experience, anything. Just make yourself stand out and say, hey, so I had low scores, or, I have a gap year, but this is what I did during this time. This helped me grow as a person. Things of that sort. So try to make yourself stand out in your application. You can do this really in your personal statement. Try to show a passion for medicine, a passion for whatever it is that you want to do in your life, and really, really make that an essential part of your application. Yes, those are my little tips, and I'm happy to talk more when people have questions. I'll pass the mic along to Dr. Washington again.
Okay, thank you. And so the idea of networking and making yourself stand out, thank you. I always tell everyone, regardless of what you might think is a challenge, there's a way to turn it around. Dr. Shashil, would you please join us and tell us about your journey?
Hello, everyone. I'm Shashil. I'm here in Chicago. It's a good morning. It's a nice morning here. I think you guys are from India, from Nepal, and somewhere else from the world. So good evening, good afternoon. So I am Shashil. I'm from Nepal. I was born there and I grew up in Nepal. And I did my medical school in Kathmandu University, which is one of the two universities in Nepal. And I graduated in 2016. And after that, I did a medical officer job in one of the tertiary cancer hospital centers in Nepal. And then during the meantime, I prepared for my USMLE and I matched in 2021. So for all the people out there like who are applying, you have done a tremendous job. Like preparing for USMLE is a very enormous. It's an enormous effort. So that's and I mean thumbs up to you guys. So tip from me is like nowadays the matching process has changed, and the thing that is most important is the contacts. So I got like 6 interviews. I had very good scores. I mean, I'm not bluffing, but I had very good scores, but I just got 6 interviews, and 5 of them were from contacts. And 5 of them were from contacts, and I matched into the program which I did not have any contacts. So I have like I had to balance both of these, that contacts work or contacts do not work. So the one thing is just make contacts with the colleagues, with the seniors that you have in the program, and I'm telling you, the scores are one of the most important thing that is seen by the program directors here in the States. However, if you don't have high scores, don't panic. There are other things how you can make your CV look great. So there are some research experience that you can work with. You can have some published publications in like good journals, and also the clinical experience that you can gain in your home country is the like plus point that we can have in here. So you work there after your graduation. 2016, let's say 2016 was my graduation, and I matched in 2021. So those 5 years are not the gap year for us. So these are those 5 years are the year that we did get the what do I say, clinical experience back home. So this, it is going to help because the patients here are the same. They have the same disease. They come with the same heart failure. They come with the same gastric cancer. They come with the same hematuria or UTI. So the clinical experience back home really helps. And the other thing that I can like focus on is the getting the good letter of recommendation from the, more importantly, from the US clinical doctor, US doctors, if not from your home country. So both will have a good impact on your CV. However, getting a good recommendation from a US physician will be a better one. So talking about Dr. Washington, the only thing that COVID did great to me is I went to do externship with Dr. Washington because of COVID. I was staying there in California, and I searched for his externship, and he selected me. So I went there. I learned a lot of things. I believe he wrote a good letter of recommendation because I think I impressed him a lot. So three things that I as a matched like candidate I can tell you is, if you are not done with the steps, please try to get good scores in nowadays in step 2 CK, and step 3 also helps. If not, try to make connections and try to get involved in researches and get a good letter of recommendation from the American physician. So these are the few things that I want to focus on.
Thank you, Dr. Shashil. That was great. Now we'd like to hear from Dr. Priyanka. Please join us and tell us about your journey.
Hi everyone, this is Priyanka. I go by Priyanka, and I'm originally from India. I graduated from Deccan College of Medical Sciences in Hyderabad, from southern part of India, and I graduated a few years ago. Like, I graduated in 2011, and then I worked there as a chief medical officer for a few months in a multi-specialty hospital. And after that, I was working as an ICU physician for a year, where I was independently managing the step down. So, and then after that, I moved to the US, and due to some reasons, I had a gap in medical training for a few years. And then I completed my steps. Once I completed my steps, I started looking for clinical experience. I did some rotations in inpatient hospitals, and then I started looking for more opportunities when I started working as a scribe in Stanford Primary Care. And when I was working there, I tried to form more connections, and I found like a couple of more other opportunities where I could work on research. So simultaneously, when I was working as a scribe, I was working on a clinical project, like quality improvement project. And I was also working in the stem cell biology department as a peer review publisher too. And around that time is when I got in touch with Dr. Washington, and I started. So I was already working 5 to 6 shifts in at Stanford, which includes my scribing and research. So Dr. Washington, actually, I had a discussion with him. So this is my schedule, and I asked him if I could work with him once every week, and he agreed to it. So I was rotating with Dr. Washington once every week, and the remaining days I was working on scribing and the research projects. So this entire thing. So one of the tips I would like to add here is, in spite of the gap, trying to look for opportunities even when I was doing other things. I think that is what stood out in my application, that okay, I am committed. Once I started preparing and applying, started preparing for the application, so I could show the commitment that I am here for this. So another tip I would like to give all the applicants, which is very important when you're doing rotations, because the rotations last for a very short duration. Start putting in the work from day one. Don't wait for someone to tell you what to do, or or thinking, okay, maybe this is right or not, because most of us are experienced physician back home. We have worked during internship year. We know what to do in a particular clinical scenario. So don't doubt yourself, put in the work and ask for feedback early in the rotations itself. At least like around the end of the first week, ask for feedback. Is there anything I should be doing differently? Or do you have any suggestions or any advice? Ask your physicians, because they are looking at your work and they'll have very good feedback for you. I think that made a lot of difference with all the physicians I worked with and all the researchers I worked with too. And that will help you change your work, which can reflect in your letters, how you take the feedback and how you put in the work advice that is given to you. So this is a very important factor. If you consider that, your rotations can be more than what you expected it to be. You get a chance to learn more stuff, and by the end of it, you will feel the difference. When you look back, you'll be like, okay, I didn't know this and I learned this. It may not be a clinical thing, it can be a non-clinical thing, a communication skill, or receiving critical feedback in a learning how to receive a critical feedback. All these things, it could be anything apart from clinical, because we already learned a lot of clinical things back home and worked on it too. So there are many other aspects where you can improve. So that's my biggest suggestion, and I would be happy to answer more questions during the uh, Q&A session also. And I would hand over the mic to Dr. Washington.
Well, thank you, Dr. Priyanka. That was well put. What I heard you say is that there was a way for you to turn the gap years into an advantage for you by developing your skill set, and you talked about confidence of going in from day one in your externship experience to try to impress the mentor. In this case, it was me, and I was greatly impressed. And then, Dr. Michael, you described how having the confidence to cold call the residency programs and try to make a connection. Would you please, someone has asked, who to call at the residency program in order to network? Dr. Shashil mentioned that it's important to have a contact there. You didn't have a contact. How did you go about creating your contact? Oh, turn on your mic, please.
Yeah, so I mean, getting interviews is more about contacts nowadays. I mean, I'm being realistic. Like, you can have everything in the world, but having a contact is the one that will give you interviews. So that one program that I pre-matched into, I did not have any contacts. I do not know how they call me for interviews. There are like 6,000 applicants for like 10 internal medicine or 10 family medicine program like seats. So among the 5,000, I do not like believe that they are gonna go through all of those 5,000 applicants and see who will stand out. They will have their own like they will. How do I say this? I'm sorry. I'm out of words.
They'll have their screening protocols.
They will have the screening criteria that, okay, this person was a graduate of this year, so he's not included. So this person has this, he's not included. Maybe I came into their screening process and I was not thrown away during that time. That's why I got an interview. But most importantly, having the good scores, I just got 6 interviews, and all 5, I mean 5 of them were from contact. So please, I'm telling you guys, you have to make contacts, and it's for getting the interviews, not for the matching into the program. It's for getting the interviews. Matching into the program, it depends on your interview skills, how you present yourself, how you can describe your CV, how you can describe your extracurricular activities, and how you can describe a lot of things that you have mentioned in your CVs. Most important thing after you get an interview is work on your interview skills. That's what I got from Dr. Washington when I did externship during my match process.
Thank you. And Dr. Michael, tell us about how you made your contacts. Your mic, please. Is your mic on? Your microphone? We'll try to get back to you with that. I can't hear your reply. I heard Dr. Niru say earlier how important it is to start early on your process, and the idea is that you might be able to learn how to make contacts in the States. You get your externship early. You learn your skills early. Someone has asked the importance of the scores and what constitutes good scores. Dr. Michael suggested that scores are different for U.S. trained versus IMGs. Dr. Niru or Dr. Shashil, did you have any ideas that you wanted to share about what constitutes a good score?
Sure, I can take this one. So I think now that the step 1 exam is a pass-fail exam, it's your step 2 CK scores become really crucial to your application.
Yes.
So first of all, you don't want a score that's below maybe say 230. You absolutely want to avoid that. A good score, I would say, is anywhere 250, 255 and up, and that'll really make you stand out. You don't have CS anymore, so really like your step 2 CK score is going to be something, if you do really well on it, it's going to make you stand out. So I think it's very important.
Okay, thank you. Someone has asked about the importance of interview skills and how to improve your interview skills. We've talked about the importance of communication. Does anyone have an idea as to what they'd like to say about interview skills? I myself talk about the importance of having confidence. Very often, people that are trained, students have been for so long, they're used to seeing the person interviewing them as an authority figure rather than looking at them as another person, another colleague, someone with whom they can have a conversation and make a connection. And so I frequently, if you take that perspective, you're much more likely to be able to make a connection and they'll select you.
Testing.
Yeah.
There you are, Michael. You can join us now?
Yes. Apologies about that. You mind if I just go back on the previous question there?
Yes, to make contacts.
Yeah, so just to that point, just really briefly, like I definitely agree with Dr. Shahil about that. I've been on the residency admissions committee, and I can tell you for sure, definitely step scores are important. They're the initial screening process. But that being said, once you're within a particular range, like if you're 230s, you're 230s. If you're 220s, you're 220s. Like 210s, you're 210s. It doesn't really matter within that range. But we have hired people who are personal friends of our interns of the second years or whatever. They pull their applications out and they take a look from there. In my experience, I personally did not have any contact in the States at all. I didn't know anybody from any programs. So I had to kind of create my own contacts, which is why I cold called almost every program. And in my opinion, it's definitely a very, very good tip, but it's also a double-edged sword because if you don't have the right communication skills, if you're not able to make small talk and make jokes and do your research before the phone conversation, then they're going to be, this is just like a name that they can cross off, right? And so that's where I think the communication skills really, really come into play. Dr. Washington's great with that. He teaches you how to, the nonverbal communication part, what to look out for, what to say. These tips definitely have helped me in getting the interview process. Yeah, I mean, that's pretty much what I wanted to say. Just don't be shy, go for it, but be very, very well prepared.
Michael, when you talk about being well prepared, you mean that it sounds like you did.
When I made the Excel sheet of all the program in the States, I basically went on every single website. The first person I contact, if I do make a phone call, is always going to be the program coordinator. If they don't pick up, I send them an email and I make a mark on my Excel sheet that I sent them an email. During the phone call, what I'll do is I'll go through the program. I'll see what their step scores are, right? I'll see if they're a rural program or if they're an urban program, what their focus are. Is it inpatient? Is it outpatient? Is it OB focused? I'll take a look at some of the residents. Actually, I'll take a look at all the residents, every single resident file. I would briefly read. I'll scan. I'll be like, oh, this guy was, he was Canadian, like, and he matched. And so, I'll talk about, like some of the attendees might have, studied abroad in Europe as well. And I'll be like, oh, I studied abroad too. So all these little facts, like I would scour every single detail on their website and just pick 2 or 3 points. It kind of also that I did was, if your step scores, you need like a 220 to match into your program. Like I had like a 218, like I was slightly below it. I'm afraid, but I generally want to match your program. This is what I'm looking for. Like I love, rural programs. I love how you can make a connection with the community there. I love the fact that your residents seem like they're a very fun program. They do a lot of activities together. And I'm all about that team building process. And I think, this is compared to other programs, this is kind of a place that I think I'll actually enjoy over the next 3 years and have a good chance of staying in the area afterwards. That's also very, very big. They like to retain their residents within the area. So.
Okay, thank you. Someone has asked how important having a externship is. And Dr. Priyanka, you mentioned what you thought about externship and the letter of recommendation you get. Did you want to make a comment there?
Yeah, definitely. So, and I think I missed mentioning earlier. So I matched into internal medicine at Texas Tech University in El Paso. So the externship experience, it has been really important. So because it is a chance where you get to do a completely hands-on experience. So this was an opportunity where I could do more stuff than any other of my rotations, because I could do everything what I did at other places. At some places, I had only access to electronic medical records. For example, when I'm working as a scribe, there was not much hands-on experience that I could get, but I was completely creating the notes. I was fully trained for that part. And working at the externship, it was an opportunity for me to conduct physical examinations, talk to the patients under Dr. Washington's supervision. And at the same time, I had a chance to counsel the patients. So which is very important in communication point of view. And at the same time, getting feedback from Dr. Washington on how to counsel the patients or how to move forward. So you have recurring patients. With Dr. Washington, I had quite a few recurring patients. So how to move forward or how to develop your relation with the patients. So this part of communication skill is very important, which can also reflect in your interview skills, because there was one question that came up during my interview where the program director asked me, was there anyone ever criticized you about anything? So the first thing I could come up with was, okay, Dr. Washington used to always tell me, don't hesitate to ask some questions beyond your clinical physician, because you are a physician, you are taking care of the patient as a whole. So asking them if they are traveling, okay, if you're traveling, do you have accommodations from your health point of view also? These kind of questions. So I would hesitate that. So if you see that, it helped on multiple levels, helping the patient improve themselves, and getting a feedback from your mentor saying that you can ask these questions. And it reflected in my interview where the program director understood how I received the critical feedback. And the end result was I had good relation with the patient also on the go. It improved my relation. So this kind of opportunity you will get only in an externship, I believe, where you can be more independent, do your, you get a chance to counsel the patients on your own. So in Dr. Washington's externship, you can talk to the patient and he will be sitting there watching you, what you do. And at the end of it, he gives you feedback. And if you have more questions, could I have done this? Could I have done that? And there is a lot of autonomy, and there was no situation where Dr. Washington had mentioned that, okay, no, don't do this or anything. He only says how you can improve it. And he teaches us how to do everything on the EMR. He shows us when he's filling the prescriptions, because we are not eligible to do that, but he shows how it is done. and he explains about it. He does like these sessions where he explains at the end of the day. He says, this is what is the procedure in the US, these are the limitations, and these are the rules and regulations that should be followed. So you feel well prepared to be in the clinical space, and that building that confidence will also reflect during the interviews. And in the letters too, because the PDs also said, because of your year of graduation, so your letters vouched for you, and that's the reason we are picking you. So the externship is very important, where you get a chance to explore your skills, learn stuff, and give a chance for the mentor to actually vouch for you. I think all of us commonly said that one thing, where have a good relation with your mentor, where they can vouch for you. It makes a lot of difference, I think. So they actually mentioned to me that that was one of the primary reasons, and I can, from the other doctors' experience also, I feel it holds true to a great extent, and it can cover for any of the gaps that you have in your CV, be it scores, gap years, or anything. Because I did not have any contacts at the program, I didn't know how, and so this was one of the biggest factors. So externship, you have an opportunity to cover any gaps you have, and talk to the mentor about it. If you have any questions or doubts about your CV, I have this gap, I think I may not match because of it, what can I do?
Right.
So you have that kind of freedom. So
Thank you for that feedback. Yeah. And you talked about how important it is to have a strong letter of recommendation, one that perhaps is detailed, that is personal, and that gives feedback to you called it a PD, the program director, the residency program director, who's making the choices as to who gets selected. And the idea being is that you want someone to vouch for you as an applicant, so that the program director has faith that you'll be able to be successful. Dr. Niru, I've heard you say how important letters of recommendation were for you, that vouching for you with the PD. Did you have a comment?
Sure, I was just going to piggyback off what Priyanka said. I think I did not have any personal contacts at my program either, and at any of the programs that I interviewed at, but my PI, my principal investigator, so this is my research mentor that I was working with at UCSF, she was kind enough to reach out to program directors at places that I was applying. And a lot of them got back to her, saying, hey, thanks for reaching out. Thanks for bringing your attention to this candidate. Looks like she has a great CV. And it turned out that a couple of the program directors that she had reached out had been her classmates, kind of from her residency program. I ended up getting an interview with them. And, when I interviewed with them, they said, if Mary is going to vouch for you, I would be happy to take you. So things of that sort. So you don't have to personally have a connection at every program that you're applying at. But if you have people that are well connected that can vouch for you, that goes a long way. And that kind of reflects in terms of the letters of recommendation that they write for you. So make sure that you make some good, like at least 2 or 3 good, strong contacts in the country, and have these people write letters for you. And that really goes a long way in your application.
Well, thank you. Thank you. In terms of letters of recommendation, what I've answered for those that have asked me is that the golden ticket to being able to match is to have a letter, to have someone vouch for you who knows the program director personally and will say to the program director, yes, you can feel safe in taking this particular candidate. You can imagine if you had someone that you knew that gave you that kind of information. Well, that's not always possible. The second best thing is to have a letter of recommendation that is detailed and personalized, that the program director can have faith in. Unfortunately, sometimes letters of recommendation are generic. And to that end, someone has asked about the benefit of what they call the telehealth externships, and are they useful? And Dr. Shashil, you've mentioned to me that you had some ideas about the telehealth externships and letters of recommendation that come from them, unfortunately generic. Would you add to that, please?
Yes, sure. So obviously I can see some questions regarding tele versus externship. So on-site externship is the best that you can do. And after that, it comes observership. After that, it comes tele-rotations. So it's not that it does not carry any significance. However, like because of this COVID, we were not able to travel around, and like many physicians took this opportunity. Rotation, you are involved in the discussions that you do with your mentor. You are involved in the like Q&As. You talk to the patients. You talk to your mentor regarding the plans for the patient. And if you are able to like work with your mentor, and if you are able to impress the mentor, I believe they can give you a personalized letter of recommendation, which carries a huge difference in matching into some programs. So I mean, matching into the residency program. I'm sorry, I said some, but matching into the residency program. So getting a personalized letter of recommendation is more important than like just paying some money and getting the generalized letter of recommendation. In my program, I can say that the generalized letter of recommendation carries no benefit over the other applicants.
Thank you, Dr. Michael. I recall you saying something about you're actually worked on the admissions panel for your residency program, and that you had understood what a rich letter of recommendation would be versus what Dr. Shashil describes as a generic. Would you comment on that for us?
Yeah, I mean, I've read through like hundreds of letters of recommendations, hundreds of personal statements. You'd be surprised like how many letters are just they're very generic. It almost seems like a template. Some of them will say they'll apply for like family medicine programs, but then the letter of recommendations will come from like a psychiatry attending who says they recommend the applicant for psychiatry, and for those we just kind of toss out, and sometimes we even trick the applicant during the interview. We say, did you apply for any other specialties? Sometimes they'll say no, and then we know right away like this guy just he just lies. So, but I'll tell you guys what, like, I mean, when I applied for my program, I already had 4 letters of recommendation into the ERAS portal. On the day of my Mount Sinai application and all the future interviews, I literally took Dr. Washington's letter, I handed it to them, and I said, listen, I already know I had 4 letters. This is the maximum number that's allowed. This is a letter from an attendant that I work closely with. I think I did well. I'm not sure. This is a sealed letter. But if you guys want to take a look at it. If not, feel free to throw it away. Guys, let me tell you, like, all the programs that I gave that letter to, every single one of them opened that letter. Nobody threw it away. And I've gotten so many feedbacks about that letter, especially from my program, Mount Sinai. They specifically said, hey, this last letter that you gave us was excellent. It was like very concise. There were a lot of like adjectives that they used to describe me, like, like being on time, being professional. It was very, very well written. They gave a couple of personal examples that I did during, I don't remember what it was now, but it was very personal about what I did during that elective. It said that I was completely, fascinated with family medicine, that I only wanted to do family medicine. These are very, very key points that 99.9% of letters just do not mention. And not to mention the letter that I actually got from Washington. Dr. Washington was very, very, it was like I think it was like 1 page or something, but it was very long because they basically like flashed it at me. So I kind of saw how it looked like. But definitely, if you're going to get a letter, make sure that it's from someone you trust, from someone that knows you, from someone that's not just going to brush you off. And it's got to be someone that you work closely with. Like I've had externships where I've worked with people who had, like 10 medical students there, and the attendant doesn't even know their name, right? And so how can you expect a good letter from them? So,
thank you.
Yeah.
And Dr. Niru and Dr. Priyanka, you mentioned that your letters vouched for you strongly, and you felt that that was key to your being successful after the interview process. Would you concur?
I definitely would. So because, and I also agree with the point of, in my case, it was a similar case. I know it's different, but I was committed to internal medicine. I only applied for internal medicine specialty. So, and I was very clear about that. Even with Dr. Washington, it's a family medicine clinic, but we always had conversations about how internal medicine and family medicine are different and what is common among these. So I was committed to internal medicine specialty, and this is, I think, an important factor too, where I worked all my rotations in internal medicine, and I got personalized letters from there. And in spite of having a family medicine externship, I had a personalized letter for internal medicine, which highlighted my uh, skills, which will be good for internal medicine specialty, because I was only applying for that. And Dr. Washington and I had discussions about it, and I could get a letter which is dedicated to the specialty I was committed in. And it is definitely very important. Dedicate, like, make it very clear to your mentor what specialty you're applying to, and they will see the skills when you're working, which is directed towards that specialty or not, and what you can improve in that direction. And that definitely helped. I completely agree with Dr. Michael on this aspect, and most of what he talked about holds true in my case too.
Thank you. Thank you. I see a question here in our chat asking about the difference between telehealth and observerships and on-site. And what I've, as a result of the kind of information that I have about how useful a telehealth externship is, what I've done is drastically reduce the price of the telehealth externship that we offer, because I know that the generic letter is not going to carry much weight, as Dr. Shashil has pointed out. What my feeling is, though, is that via the telehealth, when we do our live stream, all the observers can see how it is that young doctors like the ones you see before you can interact and be coached to talk to the patients, and you learn what they learn. And then you have the opportunity to use this telehealth externship as a primer to understand U.S. healthcare and insurance and co-payments and disability and the kinds of things that they learn on site, so that you, when you have the opportunity to get your own on site, that you will take the tips that you hear from these young doctors and make a strong impression and create a connection with the person that's going to write your letter, and then so that they can write you a strong letter and vouch for you, because that is so important. Yes, so thank you for adding that. We're using our telehealth as a primer for those who participate, that says that they receive that kind of education, and hopefully they'll go on and get an on-site. Let's see. So we've also got a question with regard to family. Someone has asked whether or not being married or having a family can be a hindrance. And Dr. Priyanka, perhaps Dr. Shashil, you might have some insight for our IMGs, do you? Dr. Shashil?
Oh yeah, yes. So it does not matter for me. What I have seen in my program is being married does not carry any like drawback in your application. So it's your life. You can be married. You can you can have anything. You can have kids. It's your
Sure.
life. So the only thing that matters is what your CV says. What your I mean experience as a physician is. It does not matter what being having a kid does not matter. And telling you guys, I just got a kid like 6 months ago, and I do not rush back home to see my kid. I would do my work, I complete my work, and I then come back home. So I don't think it matters, but I don't know what's the take.
Thank you. Any thoughts,
guys?
Dr. Priyanka?
Yeah, I completely agree. It does not, see, what matters is how you handle it, how you're going to mold your work and personal life together. So as long as you're putting in all your work and managing your family, which is important to you, no one really actually asks, okay, do you have a family or do you not have a family? No, it is not so black and white. Okay, so everyone has a life outside of residency. It's about how you balance both of them. And I just had a baby too. So I just had a baby like 6 weeks ago. Okay, so and the program has been really supportive because everyone has a life outside of residency, and everyone knows that, they understand that. And as long as you're being professional, honest about it, and have a discussion with whoever you're working with, like, okay, they need to know, at least you have a heads up, but it's not going to hinder your professional duties. As long as that does not happen, no, it does not matter. Just remember one thing, everyone has a life outside of residency, and it's okay.
Thank you. So many of the people that are on the admissions committees are of a different generation, where it was thought that women who might be pregnant or going to have a family, if men were married, they might be less dedicated to working hard. However, it's the character of the individual that will determine whether they continue to contribute. And that comes off in your personal statement, and it comes off in your interview skills, right? And it's not legal really to ask people in an interview whether or not what their family situation is. However, if anyone had the suspicion that it was going to be held against them, well, again, I'd say always be confident, right? The fact that a person has a family means that they have strength in their character, that they have help at home. Perhaps their in-laws may be contributing to their being solid and being totally dedicated while they're at the hospital. So always turn every question, every challenge into a positive as best you can.
And could I just maybe add to that?
Please.
As I said, it's not legal for somebody to ask you if you're married, if you have kids, or you're planning to have kids. Like that line of questioning is a little inappropriate. It's considered inappropriate.
Very
and then
inappropriate.
if you get the sense that a program is kind of judging you or trying to get that information and might hold that against you, maybe that's not a good fit, because you really need to decide what's important for you. And maybe if you want to, maybe going into a program that's going to hold that against you is not the best thing for you. So, also take that into consideration when you're rank listing the programs.
Yeah, I completely agree. Like, if you get that kind of vibe, maybe it's not a good program for you. It's not a good match. So,
yeah, I just want to add also, I think that generally the way they go about asking that is they ask, what ties do you have to the city, or what ties do you have to the hospital? It could be family or friends or whatever. I personally wouldn't necessarily volunteer that information that, like you're married and, you have to go home and see your kids. But that being said, I have had, like, you can always just refuse to answer the question. Like for my interview, they literally asked me like how many other interviews that I had, and I just told them I didn't want to answer, and then they hired me. So it is what it is. You just gotta have confidence and just be like, I know what I'm worth. You have to be willing to show that you're willing to walk away as well, because it shows that you know what you're doing. So.
Right. So I always try to help IMGs to have confidence in themselves. Unfortunately, very often medical school training can be very hierarchical, and the teachers tend to make the students feel less than, and that they have an obligation to answer whatever they've been asked in a way that is that the teacher feels is appropriate, right? So if someone were to ask me, for example, how many other interviews have you had? I might answer, well, help me to understand, how does having that information help you identify me as a good fit during this interview process? Well, it turns out there could be no good way. There's no good answer for that, right? So I've asked them the situation. I'm trying to be helpful, right? So if someone were to say, well, what are your plans for family? How does that help you evaluate me as a candidate? What are they going to say? Because if you have family, we're going to do the illegal thing and nix you as a candidate, right? So the idea is that your personal confidence and how you interact with people, your communication skills can be your ticket for for interviewing. I wanted to thank all our panelists for giving of their time so graciously to give back to the IMGs so that they can learn best practices. How many LORs do you need and that sort of thing? We have answers for that. Once again, I want to invite people to consider the idea is to, when you're going to do an externship, when you're going to go to an interview, it's a human connection that you're going to make. And the more confidence you have, the more research that you do on the person you're likely to meet, then the more connections you'll be able to make and feel comfortable with you, and they'll select you perhaps as a good candidate, write you a good letter, maybe bring you into their residency program. Once again, communication skills are key, and I hope you'll take advantage of your every opportunity to learn those kinds of things. So thank you, panelists, and I appreciate your time, and good luck to you in the future. Thank you very much. Bye now.
Thank you all. Thank you.
Thank you, everyone.
Yes, for those of
Thank
you,
you so much. Bye-bye.
those of you are participating, IMGs that are interested in trying the telehealth externship that we start on August 1st, we have an offer in this platform that allows you to use the referral coupon in order to get a discount down to the $400 price. And we hope that you'll find that useful and refer some of your colleagues and batchmates to our externship program. Thank you very much. Bye now, all.
Bye.
Thank you.
Bye.
Thank you, guys.
Thank you. Bye.